Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am Dr. Hassan and I have Dr. Hassan and Dr. Usama. So they will perform the physical examination of central nerve system. So Hassan will perform as a doctor and Usama will perform as a patient. So let's go for examination, and these are our group members: Azad, Ihsan, Hassan, Usama, Asad and Moses. So to perform physical examination, first we have to use the mnemonic like wafer. So it's like wash your hands, introduce yourself, and take permission from the patient, expose the patient, and reposition the patient. So just make the patient comfortable and make hygiene so that you can examine it well. So when the patient come first into your clinic, so you have to observe, like when the patient come and he walks, so you have just to see, like, is it he walk normally, is there is changes, and you have to see the gaits of the patient, like he coming in the linear or there is any changes in the walking. So you have to see that on the first sight when you see the patient and he's coming into your clinic. Then you can also perform some tests like for the coordination and balance, just like the heel to toe test, and to perform the rumbar test for the to check the balance of the patient. So yeah, so Dr. Hassan.
Assalamu alaikum. My name is Dr. Hassan and I'm a final year student of medicine. Today I'm going to examine the central nervous system and my patient is Usama. So what's your age?
23.
And what's your occupation?
Student.
So today we are going to examine your central nervous system. Can we have your permission?
Yes.
Okay. So first of all, we need to check the overall appearance of a patient. Next, we need to check his movement, gait. So can you stand for me?
Yes.
And you walk in the straight line for me. Come back. Now I want you to walk with toe to heel, like this, toe to toe, in a straight line. Yeah, go there. So this test is for normal movement of person. You can sit. Now we're going to perform another test. That is Romberg test. That's for the balance. We check the balance of our patient. So can you stand for me? Come this side. To face the wall. So by performing Romberg test, you must stand behind the patient because we don't know like he's normal or not. So if we're not standing, maybe he's like have some damage in the dorsal area, he will fall and he will have some injury. So you must stand behind the patient and you keep your hands like this. So can you close your eyes for 30 seconds? Now you open your eyes. Close your eyes again. Okay, that's fine. Sit.
Yeah, so thank you, Dr. Hassan. So the rumbar test is like to see the is the coordination and the balance of the patient is normal or not, because the balance is mainly controlled by three things in our body, like when you see the things and the vestibule in the ear, and another thing is like the proprioception, which takes the proprioception and goes to the brain by the dorsal column tract. So if there is any lesion in the dorsal column tract and the patient can see and he can maintain the balance, but when he closes his eyes he will suddenly fall. So that's why the doctor should stand behind the patient to hold him. So this is a rumbar test.
So next step is checking the dominance of the patient. So are you right-handed or left-handed?
Right-handed.
you must need to know like he's right-handed or left-handed, because a lot of things like they depend on your dominance, like your walking style, your movement. So if you are right-handed, you must ask the patient whether he's left-handed or right-handed.
Yeah, so when the patient talks to the doctor, so you also have to see is it he talk normally, because sometimes maybe the patient speaks something, he want to say something, but maybe it's like the meaningless words, so you cannot understand what he's saying. So it's also related to some disease, so you also have to see that in your mind, especially like in the Wernicke's area, if there is damage or the medial temporal lobe and the white matter, so it may be disorganized speech of the patient. And also there is dysarthria, like the difficult in speech. So next to check the patient's speech, and it is to check that speak normal or not. Also check the general mental and memory test by asking where are you, like to check if the patient is oriented or confused, and asked the patient to say from 20 to 1 in the reverse pattern. So you have to see like is it he focusing well on counting or not.
So now we're going to have a speech test.
Okay.
So I have something written here. Can you read this for me?
Prime Regent Street.
Can you tell me which place is this?
Classroom.
Classroom. And who is Prime Minister of Pakistan?
Shahbaz Sharif.
Okay. Okay, there's also one test, like I tell you something and you need to remember this thing. After the examination, I'll ask you what I tell you.
Okay.
So each one is in Jiangxi province.
Okay.
Go on.
So the CNS, we will be mostly focused on the cranial nerves. Like there is any policy, like we have to check on examination, a special function related to muscles like eyes and other muscles like in the tongue. So we have to see and to check the cranial nerve lesion or not. So first we have to check the olfactory, and it's mostly related with the smell sensation. So Dr. Hassan will perform.
So first we need to check the first nerve, that's olfactory nerve. So for this you have something here for smell like vinegar or spirit, and you ask the patient to distinguish between the taste. That's for smell.
Yeah, and the second nerve is optic nerve. So to check the optic nerve, we have to see that the visual acuity, visual field, and the eye movement, like is it normal or not.
Then the second nerve is optic nerve. You need to check the patient eye acuity, and we already performed this test. Like you close your one eye. Can you see my finger? So it's simple. You just check like any double vision or any difficulty in reading books. Like can you read this?
Touch the wheel. By
Yeah, it's fine.
Yeah, so that's a fine. So the optic nerve, oculomotor nerve, and the abduction nerve, they are mostly concerned with the extraocular muscles which regulate the movement of the eye. So Dr. Hassan will perform and stand here in front of the patient, and he will just move.
Yeah, you all know like the eye muscles are supplied by SO4 and our rectus is supplied by abducens nerve, and superior oblique is supplied by trochlear nerve. So we check these two nerves, but can you stay your head still and move your eyes with my finger movement? Can you see?
Yes.
We also go behind the patient, and we look for any ptosis or exophthalmos. It's okay.
So the next nerve is like facial nerve. So to check this, so we have to ask the patient to close their eyes and to make force, like to check the function of muscles, like is it normal or not, and then blow the mouth and to see like the force of the mouth muscles.
Now we need to check the facial nerve. So facial nerve supply most of the part of the face. So first I check your sensation. I put my finger on your head and you tell me when you feel it.
Yes.
Can you feel it? Now close your eyes and don't let me open them. It's okay.
It's okay. Yeah, so we already checked the third, fourth, and sixth cranial nerve. So, and the eighth cranial nerve is vestibulocochlear nerve. So it's mostly concerned with like the hearing and balance. So we already performed the Roomba test, and if there is like maybe some problems, so it can be elicited. And but also you can to perform is the patient hears normally or not. So for this, if there is some problem, we can also have some tests like Weber test and Remy test. We can perform to check like is it conducting deafness or is it like sensory neural deafness. So there is some test for that. So we don't have like the tuning for.
Yeah.
So we may not perform it. So so in the Rainy test, we mostly do like to vibrate the tuning fork and put on the patient mustard bone, and when he stops like the vibrating, then we keep the tuning fork near to the ear to check he hear or not. If he hear, then it's normal. But if he not hear, so it's mean like the bone conduction is more than as the air conduction. So these kind of tests. And another cranial nerve is hypoglossal nerve. So hypoglossal nerve is like it's also supply muscles in the tongue.
Okay.
So,
Now we check the hypoglossal nerve by examining your mouth. Can you open mouth for me? You check the position of the uvula to check like if this nerve is working good or not. And there's also one gag reflex. You put like something in the patient's mouth and he feels vomiting. So that can be a problem.
examination of the motor system. So observe the patient's overall musculature. Look for any spontaneous or involuntary movements of the limbs. Examine the muscle tone. Check placidity or increased tone, and check the strength of the muscles, because in most cases if there is like increased tone or placidity, so it's also concerned with the multiple disease. So you have to see the overall musculature of the patient, so it's also concerned with disease. And also there is some reflexes we have to check. So
For motor function, we just need to examine the patient thoroughly. We just look for muscle wasting, and there are a lot of signs like knee jerk, ankle jerk. But right now we cannot perform here because we don't have blindfold, and also the patient is wearing shoes. So these are the tests to check patient motor function. Like there is any muscle wasting or atrophy of the muscle.
yeah, so testing for the clonus. So Brinsky dorsiflex the port, test the plantar reflex and Babinski sign. In the upper motor neuron lesion, the Babinski sign will be positive. When we perform the Babinski sign, so we just scrape on the plantar and the lateral surface of the port. So when we scrape, so the patient big toe will move toward the stimulus. If it's moved towards stimulus, then it's normal. But if it's go extend and it's go back, so it's mostly occurring in the upper motor neuron lesion.
And we also have one test for the coordination, like finger coordination. You put your thumb with your finger and then you move it like this. It's okay. Now put your finger on your nose. By this test, we check the coordination of the patient, like he's coordinating well. So now it's okay.
Yeah, so Dr. Hassan already performed it by asking to touch the physician fingertips and his nose to check the balance and coordination of the patient. Test for the dysdiadochokinesia. So in this, if there is a problem in this kind of patient, they will not perform the same and repeated movement. Just like to move his hand like this, and repeatedly he cannot do this. So if there is problem, then he may not do that. Okay. So there is another test for like to see the balance. In that the patient will lay down and he will just touch his right uh, heel on the left knee to the ankle. So just like to say the patient, he will do that, and you will just see like he's doing normal or if there is any abnormality in doing these things.
And we can also check like dull and sharp sensation by pinching something sharp on his hands or dull thing. We can differentiate.
So it's also like for the nociceptors to check is it the patient feel pain or not. Testing for the sensory loss, checking from the start of the fingertips and works until you find the sensory level. Check the vibrations and different places of the upper and lower limbs. So we have just to see is it like the patient whole body, is it normally sense the stimulus, and there is also normal sense feel the pain. So it's multiple to check the multiple sense. Testing proprioception asks the patient to close the eyes and recognize the movement of the fingers. Repeat the movement first with both hands and then with both eyes.
But those.
Just like the patient will close the eyes and then I will say, close your eyes. Is it your finger moves up or down? No?
No.
Yeah. So the patient can feel like, is it move up or down? Completing the examination, you should assess the related structures. These include skeletal structures, skull, spine, extracranial blood vessels, and the skin. Because many diseases also concerned with these things. Maybe there is abnormality in the skulls, maybe there is malformation of skulls. So it's also related with multiple sensory central nervous system disease. Maybe spine, like spina bifida, and there is like the bone abnormality, just like scoliosis and kyphosis. So he's also concerned with the multiple diseases. Looking for a bone defects. So when examining the skin, look for the skin vascular malformation, which may be seen in many neurological diseases, just like neurofibromatosis. So you have also to see the skin. And last, thanks the patient and summarize your points. Ask the patient to cross-check. For example, if you take the history and at last you just summarize in front of the patient, and then ask the patient, you have these problems. If I mistakenly make something more or something less, you have to correct me.
So today we take the history of his cranial nervous system, and from my test, he's perfectly fine. I told you to remember one word in the start of my clinical examination. Do you remember that word?
Yes.
Can you repeat for me?
Each is located in GMC.
Yeah, so he remembered this word, and so he's perfectly fine. Thanks.